So, what is it like being a health insurance agent in 2025? With heated discussions around our broken healthcare system in the United States, and that one CEO being sent to meet his ancestors not too long ago, you may think that people hate me, or hate talking to me, or hate getting information from me, but here's the reality. So, I am a health insurance agent for a Medicare Advantage company. And you may be wondering, so when people call you, do they have their guard up? Are they defensive? Do they not really want to talk to you? And the reality is, no, that's not the case. I really don't get any type of rude customers calling. I'm not saying it never happens. I just did a video about surprising things I've learned about people working in call centers for insurance companies. And one of the surprising things is that I don't really get a lot of rude customers. Like I said, it definitely happens, but it does not happen a lot. I feel like people, when they call, they're calling me because they need help. They need information. They know that I'm the go-to person that has the information that they need. So no, I don't really get people who have some type of grudge or chip on their shoulder. That doesn't really happen. To me, I feel like my main job is to educate people about their choices, give them information about the plan, make sure they're fully informed about what they're getting into if they do decide to get one of our plans. So no, most of my conversations are very pleasant when I speak with people. And I also think that's because people understand that with a Medicare Advantage plan, they have a lot of recourse if there's an issue. So when you call, you know the call is recorded. You know, like since Medicare is through the federal government, there's a lot of regulations. So if someone does something it's like if someone lies to you, or if they don't give you information that you need or supposed to have, or even if they mistakenly give you the wrong information, you can report them. You can file a complaint against that person. So I do believe people know that with insurance that's through the government, you can't play around with that, and they know that. And there's not a lot that you can do if you're trying to get over on someone. Like, you can lose your license. So I think people know that, like with it being health insurance through the federal government. You also may be thinking, you also may be wondering, do people think that I'm a part of the problem when it comes to the healthcare system? And honestly, no, I don't get that people feel that way. I honestly feel like people see me as being on their level. And when I say as being on their level, as far as me most likely having the same problems as they do, it does seem at this point that people are pretty aware that the person that they're talking to when they call a company is not the person who makes the decisions. The harder it is to get a hold of someone, the more likely that's the person who's making all the decisions. So the people that you talk to when you call, most likely they have their hands tied behind their back. There's only so much they can do when it comes to their situation. They don't have any type of control over much as far as how things work. I do believe people understand that, and people seem to know that I am just trying to make a living out here. I also have to pay for insurance. Like, I've had conversations with people, they're like talking to me as if, like I said, like we're on the same level. Like, yeah, things are constantly going up, prices are constantly going up. And they say and I also hear people say, I know it's not you, but like when they're complaining about certain things, I know it's not you, but I just had a call yesterday where when I'm on a call, I have to kind of say a lot of verbatim statements. We have to go over a lot. It's a long process. And she's just like, I don't have time for all this. I don't have time for all this. Who's ever listening, don't be making them say all this. This is too much. This is why people hang up in people's face. So it's like she knew it wasn't me. I'm not the one who's forcing you to hear all this. Even though it's good information, you should listen, and I understand why we have to say it, but it is a lot and it's overkill. But yeah, no, people do not blame me, little old me, for anything that's going on in healthcare. I guess you can say I'm a part of the problem since I do work for an insurance company, but at the same time, if I wasn't there to help people or to give people information, educate them on how Medicare works or on how Medicare Advantage plans work, then who would they go to? Especially if they're not, especially if they don't really use the internet or get on the internet like that. So, okay, you may ask yourself, even before that thing with the CEO, even before there was just a lot of conversation around health insurance in America, people still do not like insurance salespeople. Fair. That's fair. Are you trying to get out? So I would argue this by saying there is good and bad people in all industries. Like there's good doctors and there's bad doctors. There's good nurses, there's bad nurses. And there is definitely certain industries where there's a higher percentage of scammers or bad people than good people, in my opinion. And I just don't think that's the insurance industry. Like I said, there's good and bad. And I do believe one reason that people don't like insurance salespeople is because there's this common like cliche thing of insurance people calling your house, trying to sell you insurance. I don't know how they did it like back in the day as far as when they would call people's houses. I don't know if they like just used the phone book and just went down the line in the phone book and just called people's houses. But my first job with insurance was making outbound calls, and we were not doing that. We had a system where people would go online and put their information on the internet, and then we would get those leads in our system. And we weren't the only ones. A plethora of other insurance offices would get these leads, and people would get calls from multiple insurance companies at the same time. And I know this because a lot of times when I would call and someone would pick up and they would say,
oh my God, I'm getting all these calls from all these different insurances. I don't know why I'm getting all these calls. They're calling me back to back to back to back.
that's a you problem. If you don't have enough sense to know not to put your information on some random website on the internet, that's your fault. That's a you problem. Sorry. Now, if you're young, I'd say under the age of 25, I'll give you a pass. Otherwise, you needed to learn that lesson. I'm sorry. Do not put your information on the internet on some random website. Why would you do that? I've never done that, and I've never gotten a call from an insurance agent. What I do, I call the insurance companies individually to do a quote for me. I do not put my information on anywhere on the websites. And that's how we get those leads, is people put, I guess, they put their information on the website, wherever, and then the information gets sent out to different insurance companies, if you didn't know. But yes, I do understand that side of it. But in this day and age, I don't think any insurance companies are calling numbers in phone books. That's how they're doing it. People are putting their information online, and that's how they get the leads. So don't put your information online and you won't get a bunch of freaking insurance agents calling your phone. And as I said, I am an insurance agent for a Medicare Advantage company. So if you're curious about the surprising things I've learned about while working in insurance in general and call centers, check out this next video. Thanks for watching.